My guest on the program is Dr. Mukhtar Mohammed, the National Incident Manager of the Presidential Steering Committee on COVID-19. Civil servants have till the 1st of December to get vaccinated, and he tells us why. Only 3.4 million Nigerians have been fully vaccinated out of our over 200 million people, and he tells us why. According to him, the 40% target for vaccination cannot be met if we continue at this pace, but some sort of work must begin. Please watch this. Dr. Mukhtar, welcome to Dateline Abuja.
Yeah, good day, Kayla. It's really a pleasure to be here.
Let's talk a bit about this mass vaccination exercise. What's the plan to get at least half of the country vaccinated? Let's just walk us through how this is supposed to work.
So the federal government, through the Federal Ministry of Health, has developed an elaborate plan to ensure that there is vaccine availability in almost every part of the country. All the states have been supplied with vaccines. Government facilities have been supplied with vaccines. Another plan is to engage the private sector because we know that 60% of healthcare is obtained from the private healthcare in this country. So to engage the private sector as well. In addition to this, we are looking at new innovations, including vaccines in public places where they will also be made available. We are starting with the FCT now. And some other states have also commenced. The whole idea is to ensure that there is access to vaccination, to make sure that when a Nigerian is looking for vaccine to be vaccinated, he readily finds it available, not far from where he stays. So that is the plan. It is an evolving plan. If you recall earlier on in the vaccination program, what we had, it was a tiered approach. We wanted to start with people who were between certain ages. We wanted to start with people who had comorbidities, people who were vulnerable. But now we are taking on all adults. All adults should have access to this vaccine. And it's something that we need to do within the shortest possible time.
So no children for now?
No children for now. Our priority is to get the adults.
So we're talking about 18 and above?
Absolutely, yes.
And that's the plan for the end of the year. You mentioned the private sector. And just to bring up something I noticed, even when it comes to testing for COVID, private facilities charge you, before you get your results. And there are variations of times when you can get your results, 24 hours, 48 hours a week. But, we always say, oh, you can go get tested, go get vaccinated, it's free. Just to explain to people why there's this disparity between, receiving a COVID vaccine in a public health institution and getting it from the private. Why is there a cost implication in many private hospitals?
So for vaccinations, all the vaccines are free. We procured, the government, or we got donations of these vaccines, and we make it available up to the facility where it is delivered for free. Handling the vaccine requires a lot of resources. There is logistics of moving the vaccine from one point to another. There is logistics of maintaining the cold storage. The vaccines have to be kept under certain minimum temperatures for some time. There is also the cost of personnel that you have to use to either move these vaccines or to administer these vaccines. There is cost for data entry. You have to use the software. You have to have a computer system or tablet or telephone or whatever is available to enter the data. There is the human resource cost that you also pay for individuals that do this. So apart from delivering the vaccine to the last point, there are also additional resources. Government is taking care of all these additional resources, which cost as much as the vaccine itself. In government public health facilities. Government has made provision for the transport, for the storage, and for the payment of personnel that are involved. Now, when you bring in private sector, it is slightly different because the private sector now have to employ people who will do this job specifically. So there is a cost to that. They have to get computers.
A little bit more to keep it cold.
Exactly, and then even the cost of storage and others. So what we've done is to work with the private sector to just look at the minimal marginal cost that they can charge for these services. However, the vaccine is delivered to them free. This is understandable because in all private, even in government, it's not that there is no cost. There is cost, but it's being paid for by government.
I hear that we have about 12 million vaccines in the country right now. We'll get to the target vaccination population for December shortly, and then the fact that civil servants have a deadline, to get themselves vaccinated. But just walk us through how many vaccines we've gotten in the country since March. Absolutely.
I know we got quite a number of vaccines. You remember we started with the AstraZeneca. We got about 4 million doses. We got Moderna, which came. We got donations of additional Oxford AstraZeneca, from other countries. We got also Johnson & Johnson, which was procured by government through the AVAT facility. So right now we are coming to a period where we now won't say that we have shortages of vaccines in the country. At least every state has enough vaccines for now, and there are a lot of vaccines also that are available that can be distributed to boost the vaccines in the state. You are right. The total vaccines that are available in the country now is said to be about 12 million doses of the combined Oxford AstraZeneca and the Moderna vaccines that are available. But what we also know is that the Federal Ministry of Health has secured vaccines that are coming into the country. We do not want to bring vaccines when there is no need for them. For example, you don't want to oversaturate the country with vaccines and then we'll end up with vaccines expiring in our hands.
Because people don't realize that vaccines actually go bad.
Yes, so we are very careful in terms of the management of the vaccines that come into the country.
So let's go to the vaccination population, because that's where we are right now. When this exercise started, 40% of the population was targeted, but just about 3.4 million Nigerians have been fully vaccinated. How are you going to ramp up this number so you can meet the target that you have for the end of the year?
It's absolutely very challenging. I'll tell you the truth. At the rate we are going, we know that we will not be able to meet this target. And that is why concerted efforts are being put by the federal government and also the states. These vaccines are administered.
We will not be able to meet this target?
We will not be able to meet 40%. No, we won't. We won't. Our target of even providing 40 million Nigerians with the vaccine by January next year, it's really a long term. It's a long haul.
What's the challenge? Why can't we meet it?
So there are several factors.
Is it vaccine hesitancy?
Absolutely. Absolutely. That is the topmost issue. Initially, we said there were no vaccines in the country. Now the vaccines are available.
Now the people don't want to come out for them.
And people are not coming out to do it.
Is the Nigerian government, in your view, doing what they can to ensure that people feel safe about taking these vaccines?
So I'll really shift a little from that, because it's not entirely, you cannot put that squarely on government alone. It is a responsibility of everybody. If you know you have members in your family, how many members of your family have gotten vaccinated? If you are convinced you have taken your own vaccination, then you need to pursue others, to persuade them to also take vaccination. It's individual, it's family, it's community. You need to work with your neighbors. Make sure that your neighbors also get... some of the people actually don't have the right information. They don't have the education. They have not been sensitized enough. And you cannot wait and say government has to come to your neighborhood and provide that level of sensitization, that level of education.
Well, Dr. Mukhtar, this is where we have to end the interview today, I'm afraid. But thank you very much for being with us on Dateline Abuja. And good luck with the work that you do.
Thank you, Kayla. It's always my pleasure to be on your program.